We are going to be talking vaccines. Hi, Robin.
Hi, how are you?
I'm fine. I know that I was really adamant today that I wanted to talk about vaccines.
And why? Did something happen recently?
Oh, there's always something that happens. You can stay here, or you want to go? You can stay here. Yeah, you can stay here. It's okay. I want him to keep me company here. We are going to talk vaccines, Puxy. Yeah, don't worry.
Hi, buddy.
You can lie down. Yeah, good boy. All right. So anyway, I saw a lady today at the beach when we were walking, and her dog was really anxious about seeing other dogs, and she was saying that she's a little aggressive, and then she said, well, I didn't let her socialize until she was fully vaccinated, which means until 4 months of age. And I know that this is one of the biggest reasons why dogs actually become maladjusted and why they become aggressive, because they don't get a chance to basically socialize with other dogs until 4 months, which is like, taking children and not letting them see any other kids until they're, 6 or 8 or 10. So that doesn't really make a lot of sense. This kind of prompted me to talk about vaccines and give you some reassurance that the safer vaccination protocols can allow your dogs to socialize and at the same time be safe and protected. I've been talking about this topic for many, many years, and it kind of baffles me that it hasn't changed. It hasn't shifted. I can see still people worrying about the same things and having a very skewed perception of immunity. I would say that the current dog vaccination protocols are fear-based, and they could be compared to the people who wear masks outside when they're running or walking because they're worried that they're going to get COVID or something. So we need to really understand immunity and how it works, and why I feel fully confident about safer vaccine protocols and immunity protocols, because they work and I've used them for more than 30 years and I haven't had, touch wood, one single failure of that. So let's talk about that. And you may have some questions, I'm sure. As a dog lover and mom of 4 dogs, you'll help me to kind of navigate through the maze of the complexity of vaccination and ask some questions and provide the best materials for our community.
Well, and I do think starting maybe right from square one, where, we've got this litter of puppies and they're with their mom, and we know that they have antibodies, but what does that mean? And how does that protect them? When does it wear off? Let's talk about the importance of that, going right back to square one.
Just to point out that not all newborn puppies have antibodies. It really depends on the immunity and the antibody levels of the mother. So it's super important, if you're a breeder, to check the mother's antibodies before she gives birth, making sure that you actually understand whether the immunity is there or not. So that's the first thing. Second, I find that dogs that are not looked after well, or have accidental pregnancies and so on, there's a lot of different issues playing a role. So the immunity may not always be there, but it's really easy and inexpensive to determine whether it's there. So that's the first thing to do. And if you get a puppy from a litter where you don't know whether the mother had adequate protection or not, then I have another kind of plan for that. But if you start with puppies, they're born and they acquire colostrum as soon as they start suckling. And the colostrum is basically the primary phase of milk. It's very kind of transparent, yellowish. It doesn't look anything like milk.
It's like buttery.
Yeah, it's kind of sticky and it's full of antibodies for protection. So when it comes to immunity, the body produces antibodies. There's two main kind of segments of immunity. One of them is humoral protection, which is the antibodies. And then there's cellular protection, which is the white blood cells and those who fight the viruses directly. When there's a virus, let's say that this Mandarin orange is a virus, and it gets in the system, and let's say the puppy has maternal antibodies from colostrum. As soon as the virus enters the body, the antibodies latch onto the virus and they neutralize it. So see it as a neutralization kind of process. Even though it's a biochemical process, it's a process when the antibodies bind to the virus.
Right. I was just going to say, for people that don't know how to test for it, what kind of test can we do to measure the antibodies of a mother or a puppy?
So in order for you to make sure the puppy is protected and also that it can socialize, there's this gray period between 0 to 12 weeks of age where you hope that your puppy has protection from the mother. Mm-hmm. But if you don't know what the protection of the mother was, you can't be certain that your puppy is protected. The other thing is that some puppies may not get enough colostrum or so on, so they may not have enough of the antibodies. So the first 12 weeks, I would say be cautious about socializing your puppy. And if you want to actually know what the antibody protection is, you can actually take antibody or titer test at the age of 8 weeks and find out whether your puppy is protected. As soon as you know that the antibodies are there, you know that if the virus comes, that it would be neutralized. It's very, very low chance that it would not happen. So I could consider any dogs that have antibody levels or any puppies that have antibody levels that are readable actually protected. Sometimes labs decide that there's a certain protective level and certain level that is not protective, but I don't think that there is any scientific basis for that. From my perspective, if I see antibodies in the bloodstream, in the blood test, then I would assume that the puppy is protected. And so what we do then, we assume that if the antibodies are there, we can actually socialize the puppies with a limited number of dogs. I wouldn't take them to dog park or somewhere where there's a lot of dogs and high chance that there are some viruses that are dangerous, like parvovirus or distemper or leptospirosis. But if you don't really measure the antibody titer until the 12 weeks, the 12 weeks is the first time I would consider any possibility of vaccination if the antibodies are absent. What happens, though, many breeders or many dog lovers and dog guardians, new parents, go and have their dogs vaccinated at 8 weeks. And this is what happens. And let's see that there are maternal antibodies. The vaccine is very similar to the natural virus, but slightly different. Okay, it is inactivated and so on. So we give the vaccine and it binds to the antibodies, the maternal antibodies. And what happens, the antibodies get actually neutralized. Okay, so if you give enough antigen or the vaccine, then it neutralizes all the maternal antibodies and you have an unprotected puppy. Okay, there's no antibody suddenly. It blows my mind that this is still going on, that we actually vaccinate puppies at the time when their immune system is completely immature and it cannot produce any antibodies. It just doesn't, it's not mature enough to produce antibodies. And that's why we have maternal antibodies. They protect the pups until they mature. So bizarrely enough, and this is the paradox that I'm trying to teach people and trying to make them understand, we should not be vaccinated puppies at least until 12 weeks. And let's say that we are now at 12 weeks. Right. And the decision whether you vaccinate or not is based on the presence of antibodies. So if you measure your puppy's antibodies, the titer test at 12 weeks, and the antibodies are present, there are many antibodies, there is a good level of antibodies, then you don't need to give vaccine, because what's going to happen, actually, you take the pup out and socialize with, low to moderate number of dogs, and your pup, while it's protected, will actually receive some exposure to the virus while they have antibodies. And they'll start creating at 12 weeks, 12 to 16, 20 weeks, they start creating antibodies. So there's a nice transition of maternal antibodies. They start declining and formation of their own antibodies. Okay. So at 12 weeks, again, if the antibodies are present, you say, okay, my dog is protected based on the maternal levels of antibodies, and I'm going to start socializing. This is how nature actually intended that to happen, right? But what we do, we basically vaccinate no matter what, quite often in veterinary medicine. And again, we may use up the maternal antibodies. We may already start seeing some formation of the antibodies in the body of the puppy, but it's still relatively immature, and I would much prefer to see if the maternal antibodies are there, and if they're there, do no vaccination. I would drop the vaccine at 12 weeks. If
Right.
there are no antibodies, I would actually give, um, ideally, vaccine for parvovirus, distemper, and maybe leptospirosis if it's in the area, but not more. Like if you think of all the other multivalent vaccines, they have, for example, 6, 7 antigens at the time.
Yeah.
So if you think of puppies that get vaccinated at 8 weeks and then 12 weeks with 6 or 7 viruses, it's like juggling 6 balls at the same time. The puppy's immune
That's a
system
lot.
is really, yeah, it's a lot.
Yeah.
Puppy's immune system is very immature, and infections normally come one at a time. But if I try to take all these oranges and try to catch them because they come at me, like it's really, really hard. And
Yeah.
Paxis check in. Anyway, so try to get vaccines that are minimal and really vaccinate against the diseases that are present and potentially life threatening, as opposed to giving other vaccines that may not be as useful. So by the time puppies are 16 weeks, they sometimes get 20 plus antigens, which is 20
Yeah.
from the immune system point of view, 20 different diseases. Plus, I've seen Lyme disease vaccine being given, or Bordetella vaccine being
Right.
given, or Giardia vaccine being given. And those are additional vaccines. And those vaccines are actually, let's say, Lyme disease vaccine. I've seen that causing the symptoms of the disease that they're supposed to prevent, because
Right.
number one, they have never been approved for humans. And guess
Yeah.
why? Because they're not safe. Number two, they're known. And I've seen that in puppies that are 6 or 12 months old. They start having symptoms of arthritis. By the age of 2, they have spondylitis or bone growth, unusual bone growth along the spine. And those vaccines are just not safe. When it comes to
Wow.
kennel cough, well, if you think of vaccine, kennel cough vaccine, it's a live vaccine, modified live vaccine. And quite often I've seen that causing the symptoms that the vaccine should prevent again. So
Agreed.
you give your dog kennel cough vaccine, it gets kennel cough, then potentially it spreads it to other dogs and so on. Why don't we just let them get the kennel cough? Because it's not a
Yeah.
life-threatening disease, and similar
Yeah.
to are called the immune system trains and practices, right?
Absolutely. Yep.
So I know I'm talking really fast and trying to give a lot of information, but I trust that it is understood that the multivalent vaccines are not optimal, because I cannot juggle so many balls in the air because I'm not a good juggler. And puppy's immune system is not really a good juggler either,
Mhm.
right? So, or if someone throws like 7 different diseases, so 7 different mandarin oranges and lemons at you, you can't really catch them all at the same time. So this is how the immune system gets really overburdened, overloaded. This is when allergies start happen,
Mhm.
vaccine reactions, and sometimes this attack and insult on the immune system can really cause serious long-term chronic
Yeah.
problems, because the body is evolving and developing, and I've seen anywhere from allergies to autoimmune disease. The
Right.
red blood cells or platelets start basically being attacked by the immune system because the immune system is going haywire.
I think it's important to note too that you can ask your vet, "Hey, can I just have a parvo distemper vaccine if you do need it?" Right?
Yes,
Like, ask your vet. Make sure you have that discussion.
absolutely. I think that people need to remember that they're the guardians of their
Yeah.
dogs,
Yeah.
and that they should not feel in any way forced or pressured to give anything unless it's legally required. In some places, rabies is legally required. So I'm not necessarily saying that it should not be done,
Right.
but really minimize the number of vaccines. So if your dog has antibodies at 12 weeks, what I would do, I would just remeasure the antibodies at 16 weeks, and then maybe 1 year, because it's very likely that at 16 weeks, if the antibodies are still there and you socialize your dog, they will persist until 1 year. And I know this is very non-conventional way, but I have been able to see actually dogs maintaining their immunity through lifetime against parvo and distemper and leptospirosis without getting the disease and without sometimes being vaccinated, which is mind blowing, right?
Incredible. Yeah.
Sometimes people ask, could we do that with rabies vaccine, for example? Not really, because rabies is not, you know, in the environment unless the dog gets bitten. And then if there is no vaccine, it can actually, there's a high risk of rabies infection.
Die.
People also ask, can we vaccinate with homeopathic nosodes? And while I've seen homeopathy work in many instances, this is not a situation that I would recommend. There is no proof that nosode vaccines or the vaccines that are made of the viruses would prevent the disease. So I would not recommend that. And, I've seen some situations where people just kind of present their nosode administration as a vaccine at the border or something like that. And that's just not possible. So we just need to be realistic. There are certain things that we need to comply with because that's just the way it is. And, I try not to battle something that actually makes reasonable sense. And I try to always go and combine the conventional and holistic or more integrative approach of medicine.
Yeah, I was going to say, like, if you're in an instance where you do have to give rabies or you are having to do a booster because your dog no longer has the antibodies to protect themselves, you can do things to support their immune system and you can do things to help, right?
Before we go there, I just want to say that that it's very unlikely that a dog that does have antibodies at 6 or 12 months will not have the antibodies at 6 years or 12 years.
Right.
The other thing is that I've never seen a dog being infected with parvo past 12 months. And just to kind of specify, I've never seen a healthy puppy that would be free of parasites and would be fed well getting parvo. It usually is not as straightforward. There's always secondary and tertiary kind of reasons and causes why the situation led to, let's say, parvovirus infection. Right. But certain areas definitely may have higher incidence than others. But going to the immunity, so considering that 80% of the immune system resides in the gut. Gut health is super important. So besides, checking the antibodies, making sure that your dog has antibodies and then socializing it while it's protected is super important, but also gut health. Mm-hmm. And if you think of the average diet of a dog, most dogs still eat kibble and their gut is compromised. There's some dogs that cannot eat much of anything and then are put on a hydrolyzed protein diet or something that doesn't even resemble food because they can't eat anything. Yeah. And it stems from inflammation in the gut from poor diet. It stems from leaky gut. It stems from immune system that has been barraged with multiple vaccines, toxins, poor food, and so on. So going back to increasing immunity, feeding either cooked or raw natural food, from my perspective, is the best way to go. Because number one, that's how dogs have evolved on raw food. They have not evolved on kibble or processed food that sits on the shelves for 6 months, 12 months. And it reflects in their digestion. It's really simple. Second, I do like administering probiotics, mainly because there are so many factors and influences in the environment these days. There's toxins, there's food that is not always ideally balanced and so on. So probiotics are one of the ways of, again, increasing the immunity. We also know that probiotics are not only important for immunity, they're good for behavioral causes or reasons. Dogs that have good microbiome actually are happier and may not be aggressive or sad or depressed or low energy.
They feel good.
They feel good, yeah. Mm-hmm. In humans, probiotics are used now for treatment of depression. For example, there are certain strains that can do that. Immune system is super complex, but maintaining it well and healthy is relatively easy. As you may know, I'm a big proponent of balancing diet with fermented vitamins, with minerals, with omega oils. Again, omega oils are super important in reducing inflammation, in strengthening the immune system, but also protecting the blood-brain barrier, because that's, again, blood-brain barrier is super important in protecting the brain from toxins and allowing only the nutrients, but not the toxicity coming to the brain. Not as important in puppies, but older dogs for dementia. And I could go on and on about these things.
Just going back to personal experience too. What was the difference between Pax and Sky? And did you have differences with their vaccine schedules throughout their life?
Yeah, both of them had to be vaccinated against rabies because we travel
Right.
internationally, and that's not, I have to comply with that. But when it comes to parvo and distemper, very interesting situation with Sky. He had positive antibodies, he had maternal antibodies, and then at 12 weeks, he didn't have parvo antibodies, I believe. Parvo, distemper, I can't remember, many years, but one or the
Okay.
other. And I decided to actually not to vaccinate him at that time. I just felt that with his good diet and overall immunity, and I would not necessarily recommend it to others, but I kind of felt that it was okay for me to measure the antibodies again at 16 weeks. And he had no antibodies. He had no parvovirus or distemper. And at the same time, at 16 weeks, he had positive antibodies. So he never actually needed to be vaccinated against parvo and distemper.
Okay.
And with PAX, I was kind of much more relaxed. He had present antibodies at 12 weeks, and then I measured them one more time at 16. And after that, I kind of felt, okay, he's socializing. He does, I do everything that I've done with other dogs. I never actually measured the antibodies again because I'm now after 30 years, I've seen that work so well that I just don't worry.
Right.
And the problem is that the current vaccination protocols obviously are based on maybe best intentions, but also business practices. Because if we give 3 vaccines, it's better for business than giving 0. Yeah, I think that I would wholeheartedly encourage all dog lovers to go for regular visits and encourage good veterinary practice. Support good veterinary practices. But if you think about it, you can get titer tests done, and it probably brings the same amount of money and less damage than if
Oh,
you
absolutely.
vaccinate with multiple vaccines, right? So um, there is it would be nice to have a very friendly discourse with colleagues who recommend these vaccine series of 7, 8, 9 different antigens, because
Yeah.
from my perspective there is no basis in the immunology science for that. And we already know that the yearly vaccines are not necessary. Now it's every 3 years, but I dare to say that it's not even necessary to vaccinate every 3 years.
Yeah.
That most likely most of the antibodies are protected, and if it comes to rabies needs to be done if it's required for travel or in certain areas. And you can go to my article as well at peterdobias.com and look for the safer vaccination protocol if you feel like I've given you too much information right now. So I just
we can link to it.
yeah, we can do that.
Okay, so just before we finish and wrap up today, just to give everyone an outline of from beginning to end, what do you recommend for vaccinations protocols?
I'll try to be simple and succinct. So if you have any control over, or if you live with the mother of the future puppies that are about to be born, make sure that you check the antibodies. You don't need to necessarily vaccinate, especially don't vaccinate during pregnancy. But I would check the antibodies maybe before even you're planning puppies. If it's unplanned pregnancy or a little more, the Wild West kind of pregnancy, then there's nothing much you can do than check the puppies if you have not had any control over testing the mother and so on. But testing the mother would be first. Also making sure that the mother is free of parasites. Not deworming routinely, but checking the fecal sample at least twice before the pregnancy. So when the puppies are born, then ensuring that they get the colostrum, that they all suckle as soon as possible. And then if you really want to socialize the puppies as soon as you get them, so at 8 weeks, take the first antibody test, see whether the titers are present. And then if they're present, go ahead and socialize with limited number of dogs, a few dogs, just so they can develop social skills. If you want to wait until 12 weeks for the titer test due to cost reasons or other reasons, then do it then. Do titer test before you vaccinate. If the titer is positive, repeat titer, do not vaccinate, and repeat a titer at 16 weeks. If the titer is positive again, You have a choice of repeating it at 6 months or even 12 months. If you have antibodies at 16 weeks, it's most likely they'll persist until 1 year. So again, 8 is optional, 12 for sure, 16 for sure, and 1 year. And then after that, you can decide whether you'll do another titer test at 2 years. If your dog does not have antibodies at 12 weeks, I would recommend limited number of antigens in a vaccine. It's very hard to get. So you may ask your vet, do you have any vaccines that have only distemper and parvo, or distemper, parvo, or leptospirosis? But it's harder and harder to get those. Now, when you vaccinate at 12 weeks because your dog had no protection and you decided to do so, you do not need to do booster at 16 weeks. What you need to do is to repeat titer test and see whether the protection is there. If protection is there, do another titer test at 1 year. If protection is not there, then you can vaccinate again. But that would be the only situation that I would vaccinate at 16 weeks. And it's very, very rare that after vaccinated 12 weeks, you would not have any protection at 16. But it can happen, okay, for various variety of reasons. So that's about it. And then after 1-2 years, if you're really worried, do antibody tests as often as you wish, once a year, once every 3 years. And if you feel more comfortable that your dog has been socialized and there has been enough exposure to the environment, then you most likely don't need to do the titer testing or vaccines until the very end of their lives. And hopefully it's going to be long. Again, I do believe that vaccines expose our dogs not only to multitude of antigens, viruses, pathogens at the same time, which is not healthy for the immune system. Also, vaccines are not exactly toxin-free. Sometimes they can have tumorosol, which is a mercury-based compound, and other ingredients like formaldehyde. So it's not really great to expose them to that. So.
And is there anything else you wanted to add?
Just beware of giving too many vaccines, especially to older dogs. Like I would really encourage everyone with a dog over 1 year or 2 years not to give vaccinations and just do titer testing if you worry. I'm confident enough not to do that anymore with PAX. But if someone asks me, do PAX's titer test because it's important for us to know, I'd do that. I'd be curious. Be open-minded. And if you are not certain, ask questions, but don't let anyone intimidate you. Learn about immunity and immunology. We know that it doesn't make sense to wear masks on the street when we are not really exposed to any viruses. Like people just don't have basic understanding of immunology. And I'm saying that humbly because there are many things that I do not know, but it is mind-blowing for me to see one of my neighbors walking on his own up and down the hill and wearing a mask. And I think that the canine vaccination protocols that we are using right now do not make much more sense. But they're so ingrained in our mind and in the status quo. It's going to take decades still. The only area that I see has improved in the past 10 years is that people don't use as many collars and that they use harnesses as opposed to collars. So every time I see a harness, I go, well, maybe if I stick with the vaccination protocols a little longer and teach people, it's gonna eventually stick. But oh my goodness, it drives me crazy.
And I do think,
but I feel comfortable.
Right, continuing to talk about it, because I find even now, like, how many years have we been talking about titers? But sometimes people are in an area where they're not talked about and they don't know what they are. So it's great to continue sharing that information, right?
It's great to rehash a little bit for sure.
Yeah.
I like talking about these things and I like hanging out with you and knowing that we can make a difference. They say that one of the key routes to happiness is to have a sense of purpose, and I definitely feel that I can continue contributing, and I don't have any material interests in either promoting vaccines or not. I like to be kind of moderate. I don't necessarily say that all vaccines are bad, but I really like to use common sense and I like to question. And the challenge, I think, in veterinary medicine is that, when we go through school, if we don't follow the protocols that have been set, we fail at exams, right? Or if we don't know, we fail at exams. So it's just been so embedded in our veterinary culture that we are afraid not knowing, and we stop questioning and asking and challenging the status quo enough. And we don't ask enough, does it make sense or not? And those are the things that I really would love to see changing.
Well, thank you so much.
You're welcome so much. It's been fun. Amplify optimism. I took the team today.